Before finishing this video, you would never know that almost 20 seniors will receive a devastating dementia diagnosis, one person every 66 seconds. But the most horrible part? The main reason is not getting older. It is sitting right there in your medicine cabinet. They told you these pills are safe, necessary, good for you. But new research is showing a big alert. 99% of seniors have no idea. The medicine they take every single day is shrinking their memory center by 28% in less than 12 months. Think about that. I know this sounds scary. My name is Dr. James Cole. I have seen this too many times. People trust their medicines. If a doctor gave it, it must be fine. But the pharma industry has known about this for decades. They keep making billions, and seniors keep losing their memory. A 2023 study found that one specific medicine increases dementia risk by 49% in just 2 years. That is not small. That is almost half again your normal risk. In this video, I'm going to show you the 9 most dangerous drugs for your memory. You'll be shocked when you see number 3. Millions of seniors take it for something completely harmless, but it may be shrinking your memory right now and you probably don't even realize it. Before we begin, write in the comments, what medications do you take daily? Have you experienced mental fogginess after starting a new medication? We read every comment and respond personally. Don't stay silent. Raising your voice might save your sanity. Now let's start with number 9. Almost every senior has this in their home right now. Most take it for sleep or to manage allergies. It seems perfectly safe, but it's not. Number 9 is diphenhydramine, commonly sold as Benadryl. Benadryl belongs to a family of drugs called anticholinergics, which work by blocking a critical neurotransmitter called acetylcholine. This chemical messenger helps your brain form new memories and stay alert throughout the day. As the brain ages, it becomes increasingly dependent on every drop of acetylcholine it can produce. When drugs like Benadryl disrupt this delicate process, the consequences can be truly devastating. According to a study published in the Journal of Geriatric Cognitive Health in 2023, older adults who regularly took anticholinergic drugs had a 54% higher risk of developing dementia compared to those who avoided them entirely. That's more than half the normal risk from something most people consider a harmless sleep aid. So how do you protect your precious memory? First of all, avoid anything containing diphenhydramine, especially if the label says PM, night, or allergy relief. These products are often nothing more than Benadryl disguised under a different name. If you're currently using diphenhydramine for allergies, there are much newer, non-drowsy options available, such as loratadine, sold under the name Claritin. These newer antihistamines don't cross the blood-brain barrier and are much safer for long-term use in older adults. Never stop any medication abruptly without medical guidance, but never assume that just because it's available over the counter automatically means it's safe for your brain. Next up is a medication marketed as harmless and gentle on your digestive system, but which systematically blocks the nutrients your brain desperately needs to stay sharp and healthy. Number 8. Proton pump inhibitors, specifically Prilosec and Nexium. These medications are specifically designed to reduce stomach acid production and are frequently prescribed for heartburn, GERD, and acid reflux. Many older adults continue to use these medications for years, even decades, because their bothersome symptoms return as soon as they try to stop. However, what is rarely discussed with patients is this. PPIs systematically inhibit the absorption of vitamin B12, a critical nutrient that protects brain tissue and supports memory function, focus, and mood. In a groundbreaking study published in JAMA Neurology in 2016, researchers carefully examined more than 73,000 people aged 75 and older. They discovered that regular PPI users had a 44% higher risk of developing dementia compared to those who did not use these medications. By excessively suppressing stomach acid, PPIs impair your body's ability to naturally absorb not only B12, but also magnesium and calcium, which are essential for neural transmission and brain cell signaling. When these nutrients are insufficient, your neurons struggle to function efficiently, resulting in misjudgments, confusion, and memory gaps that often closely resemble early warning signs of Alzheimer's. But the problem goes beyond nutrient deficiency. PPIs have been scientifically proven to increase amyloid beta plaque levels in the brain. These toxic proteins actively disrupt normal brain function and are considered a key factor in the progression of Alzheimer's disease. The good news is that much safer alternatives exist. If you use PPIs daily, ask your doctor if you can gradually reduce your use with H2 blockers like famotidine, sold under the brand name Pepcid. While not perfect, H2 blockers have far less impact on cognitive function. Also, deglycyrrhizinated licorice, a natural compound that coats and soothes the stomach lining, can provide symptom relief without causing any cognitive impairment. Next up is a medication frequently prescribed for bladder control problems, but one that can disrupt both your short-term memory and emotional balance. Number 7. Bladder control medication, specifically oxybutynin. Oxybutynin, sold under the brand name Dropin, is frequently prescribed to older adults struggling with urinary urgency or overactive bladder. On the surface, it seems like a practical and helpful solution. No one wants to live with the discomfort and embarrassment of frequent and urgent urination throughout the day. But this drug works by blocking acetylcholine, the same critical brain chemical as Benadryl. And unlike some milder anticholinergics, oxybutynin easily crosses the blood-brain barrier and directly affects the memory areas in your hippocampus. This makes it particularly dangerous for older adults, especially with long-term use. In a comprehensive study published in the British Medical Journal in 2019, researchers discovered that people over 65 who used potent anticholinergic drugs like oxybutynin for more than a year had a 49% higher risk of developing dementia. That's almost 1 in 2 users. Even more worrying is that the vast majority of older adults are never properly informed about these serious cognitive side effects. Patients are only told that the medication will help control their bladder. There's no mention of the possibility that each dose might accelerate cognitive decline. Cognitive damage is often mistaken for normal aging. Patients typically describe feeling mentally foggy, forgetting important appointments, constantly losing things, or suddenly having difficulty following simple conversations. It's rarely attributed to the medication until significant damage occurs. So if you're using oxybutynin and you notice any cognitive changes, it's not just your imagination, and you're not condemned to this medication to maintain bladder control. Fortunately, much newer medications like mirabegron, sold under the name Mirbatric, are available. This medication works through a completely different mechanism in your body and has far less impact on memory function. These newer medications don't block acetylcholine at all and are generally considered much safer options for older adults who need bladder control. Number 6. Statins. Statins are among the most commonly prescribed medications in the world, especially for those over 60. They are used to lower cholesterol levels and reduce your risk of heart attack and stroke. Simvastatin and atorvastatin, sold under the brand names Zocor and Lipitor, are the 2 most commonly prescribed versions. But this is where the serious problem begins. Cholesterol isn't just a heart health issue, it's an absolute necessity for the brain. Nearly 60% of your brain is made up of fat, and cholesterol plays a critical role in building and maintaining the myelin sheath, which helps nerve signals travel smoothly and efficiently throughout the brain. When you aggressively lower cholesterol with powerful drugs, you may be depriving your brain of exactly what it needs to function properly. In a study published in Frontiers in Aging Neuroscience in 2023, researchers found that older adults over 70 who had been using statins continuously for more than 3 years had a 26% higher risk of mild cognitive impairment. Those taking high doses of statins experienced even more significant declines in cognitive function. Even more alarming, some patients reported experiencing sudden onset memory loss. Those unsettling moments when you can't remember familiar names, recent conversations, or routes you've taken over the years. It's crucial to understand that not all statins affect the brain equally. Drugs like pravastatin and rosuvastatin don't cross the blood-brain barrier as easily and are considered significantly less risky in terms of cognitive side effects. If you've been using statins for years and notice mental fog, increased forgetfulness, or growing confusion, it may be time to have a serious conversation with your doctor about either a dose reduction or an alternative cholesterol management strategy. Don't wait until the damage is irreversible. The sooner you take decisive action, the greater your chance of protecting your sanity for years to come. Number 5. Benzodiazepines. Benzodiazepines, encompassing commonly prescribed drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are among the most frequently prescribed medications in America for anxiety disorders and sleep problems. They work by boosting GABA, your brain's natural calming chemical that reduces overstimulation and nervous system activity. Initially, these drugs seem like lifesavers. They calm rapid thoughts, alleviate panic attacks, and help you fall asleep at night. But over time, these drugs transform into something else entirely. They become an inescapable trap. A study published in the British Medical Journal in 2022 followed more than 8,000 older adults for 6 years and found that those who used benzodiazepines for more than 3 months had a 51% higher risk of developing Alzheimer's. The risk is even higher with long-acting benzodiazepines, such as diazepam, which stay in the body much longer and accumulate in fatty tissues, including brain tissue. What happens is a kind of chemical numbness that gradually slows neural activity throughout the brain. This means your brain stops learning new information as quickly as it should. It becomes less flexible, less efficient, and confusion, memory gaps, and emotional numbness increase. Older adults who regularly take benzodiazepines often describe feeling as if they are constantly moving through a fog, detached from reality, or no longer being themselves. The worst part is the process when they try to stop taking the medication. Withdrawal symptoms such as severe anxiety, agitation, and debilitating insomnia can be extremely intense, making the medication feel indispensable. However, the root of the problem is the medication itself. To correct this dangerous situation, you need to do exactly this. If you have been using benzodiazepines for more than a few weeks, under no circumstances should you stop suddenly. This can be really dangerous, even life-threatening. Instead, reduce the dose very slowly over weeks or even months with an experienced doctor. Buspirone, an anxiety medication that does not have a sedative effect, or cognitive behavioral therapy specifically designed for insomnia and anxiety disorders, can restore peace and tranquility without leading to progressive memory loss and cognitive decline. Number 4. Amitriptyline, sold under the brand name Elavil. Amitriptyline, sold under the brand name Elavil, is an older generation antidepressant that is still surprisingly widely prescribed for chronic pain conditions, insomnia, and occasionally migraine prevention. At first glance, it seems like a versatile miracle pill that solves multiple problems at once. But beneath the surface, it is one of the most powerful anticholinergic drugs still in widespread use today. That is, it strongly blocks the effect of acetylcholine, the chemical messenger that helps neurons communicate with each other, form new memories, and maintain mental sharpness. It blocks acetylcholine so strongly that cognitive effects are not just possible side effects, but almost inevitable consequences with long-term use. In a massive study published in JAMA Internal Medicine in 2015, which carefully examined more than 3,400 adults over the age of 65, researchers discovered that those who used high cumulative doses of anticholinergic drugs like amitriptyline for 10 years were 54% more likely to develop dementia. This is not a small increase in risk. It's more than half the normal risk of dementia. What's truly alarming is that the vast majority of these patients were never told that the drug could actively damage their memory. Often prescribed for sleep problems or nerve pain, they began to notice worrying changes such as short-term memory loss, difficulty finding words, and increasing mental confusion. High doses aren't even necessary to cause serious problems. Years of nightly low-dose amitriptyline can create a slow and invisible erosion of brain power, a drug-induced cognitive decline that occurs as completely silent sedation, initially with no symptoms, appearing as normal aging but actually preventable. If you or someone you know is using amitriptyline, talk to your doctor immediately. For nerve pain, options like duloxetine or gabapentin can offer the same relief but with a much lower anticholinergic load. For sleep problems, melatonin or very low doses of doxepin, which has a much milder anticholinergic profile, can be used with much less risk. And for mood support, there are much newer antidepressants like sertraline or escitalopram that are considered much safer for long-term brain health. Number 3. Paroxetine, sold under the brand name Paxil. Paroxetine, sold under the brand name Paxil, is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for depression and anxiety disorders. At first glance, it seems like a modern and sophisticated antidepressant. It's supposed to be gentler and safer than older generation psychiatric medications. But here's the critical point they rarely tell you. Paroxetine is the only SSRI with significant anticholinergic properties. That is, it affects acetylcholine in your brain. This single vital difference fundamentally sets it apart from its SSRI brethren like sertraline or escitalopram. In a comprehensive study published in Frontiers in Psychiatry in 2021, researchers examined the cognitive profiles of older patients using different SSRI antidepressants. They found that those using paroxetine experienced measurable declines in short-term memory, verbal recall, and attention span within the first 12 months of treatment alone. The study also revealed that older adults using paroxetine were 30% more likely to show early warning signs of cognitive decline compared to those using other common antidepressants. The ironic thing is that paroxetine is often prescribed specifically to stabilize mood and reduce anxiety. But ultimately, over time, it systematically undermines mental clarity and emotional balance. It destroys its own purpose. The solution is simple, yet absolutely essential for brain health. Completely avoid paroxetine in older adults. The American Geriatrics Association has officially included paroxetine on its Beers criteria list, which covers potentially inappropriate drugs for older adults due to safety concerns. If you are still using it, discuss switching to much safer alternatives such as sertraline or escitalopram. These drugs do not carry the same serious cognitive risks. Additionally, vitamin B supplementation, especially B12 and B6, can naturally support mood and act as an antidepressant. It can help reduce the need for it in general. Number 2. Antipsychotics. This item is particularly alarming and disturbing because many elderly people aren't even aware they're taking antipsychotics. Quetiapine, sold as Seroquel, risperidone, known as Risperdal, and olanzapine, sold as Zyprexa, were originally developed and approved to treat serious psychiatric conditions such as schizophrenia and bipolar disorder. But today, these powerful drugs are frequently prescribed off-label to elderly patients for simple sleep problems, mild agitation, or behavioral changes directly related to dementia. Yes, these drugs were designed for serious psychiatric illnesses, but now, in nursing homes and hospitals, they are routinely given to elderly people who are simply confused, restless, or difficult for staff to manage. The consequences of this practice are utterly devastating. A comprehensive study published in Lancet Healthy Longevity in 2022, following more than 25,000 older adults, found that 71% of those prescribed antipsychotics for behavioral symptoms experienced a worsening cognitive decline within just 12 months, even without a prior diagnosis of dementia. Worse, these dangerous medications significantly increase the risk of stroke, sudden cardiac death, and severe sedation. This can directly lead to falls, emergency room visits, or permanent placement in a nursing home. The mechanism behind this damage is both direct and relentless. These drugs aggressively suppress dopamine. Dopamine is critical in your brain not only for mood and motivation, but also for executive function and memory processing. When dopamine levels drop drastically, the brain becomes sluggish, slow, and unresponsive to stimuli. This is why older adults using antipsychotics often appear dull, emotionally flattened, or even zombie-like. Their personalities slowly fade away. Family members are mourning the loss of someone who is still physically present but mentally and emotionally gone. Correcting this tragic situation begins with asking difficult and direct questions. If you or a loved one is using one of these powerful medications, ask the prescribing doctor why the medication was prescribed in the first place and whether it is truly medically necessary or merely for convenience. In the vast majority of cases, behavioral symptoms can be effectively managed with non-drug methods such as establishing structured daily routines, reducing environmental noise and overstimulation, addressing underlying pain or physical discomfort, and significantly improving lighting and sleep hygiene. If medication is absolutely necessary, using the lowest possible doses for the shortest possible durations can significantly reduce harm. But often these medications are used not because of a genuine medical necessity for the patient, but to make the staff's job easier. The real tragedy is that many families are never informed of what these medications do to the brain. They simply watch their loved ones rapidly deteriorate. They never learn that the cause is a chemical process, not aging. And number 1, anticholinergic polypharmacy. This is a hidden danger that almost nobody talks about, and it's truly one of the biggest causes of drug-induced dementia in the elderly population. You might have expected a single specific drug to be number 1, but the most dangerous drug-related cause of rapid dementia in the elderly isn't a single pill. It's the silent, insidious, and cumulative effect of taking multiple drugs with anticholinergic properties at the same time. This is what medical professionals call anticholinergic polypharmacy. Consider this very common scenario. An elderly person takes diphenhydramine every night for sleep, oxybutynin daily for bladder control, amitriptyline for chronic pain management. Each drug alone might only cause mild, barely noticeable memory problems, but when taken together, they amplify, and the cumulative anticholinergic load on the brain skyrockets. This isn't just a theoretical concern or an academic worry. In an analysis published in Age and Aging in 2022, researchers followed more than 280,000 older adults and found that those with the highest anticholinergic load had a 120% higher risk of developing dementia within 10 years. That's more than double the normal risk. And the worst part is, the vast majority of these older adults weren't even aware they were taking anticholinergic medication. Nobody ever explained it to them. When you block acetylcholine from multiple different angles simultaneously, your brain doesn't just temporarily slow down. It actively begins to disintegrate and wear down. Neurons physically dry up and die from chronic use. Synapses shrink and disappear. And your brain enters a hypoactive state that looks almost identical to Alzheimer's disease on cognitive tests. It simply requires a comprehensive medication review. Ask your doctor or pharmacist to carefully assess all your prescription, over-the-counter, and even supplements for anticholinergic load. Online tools and professional software are available that can calculate this cumulative load. Once problematic medications are identified, you can systematically progress by slowly and safely reducing unnecessary medications, switching to safer alternatives whenever possible, and naturally rebalancing your brain chemistry. Honestly, this is the most empowering part of this video. Drug-induced dementia is very often reversible when caught early enough. When the medication load is removed, many older adults regain significant mental clarity, physical energy, and memory function within weeks or months of discontinuing problematic medications. Your brain is incredibly resilient and has a capacity for recovery, but only if you give it a real chance by removing what is harming it. Polypharmacy is not only dangerous and harmful, it is entirely preventable. And that makes it the #1 hidden medical threat to the minds of our entire aging population. Now I want to hear it directly from you. Which of these 9 medications are you currently taking? Have you noticed any disturbing brain fog, increased forgetfulness, or personality changes since starting a new medication? Are you ready to talk to your doctor about reviewing your medication list this week? Share your experiences and honest opinions in the comments section below. We really want to hear from you. Your story could help prevent another senior from facing the same dangerous situation. Thanks for watching. I'm Dr. James Cole, and I'm here to help you stay fit, healthy, and strong for all the years to come.